9 warning signs of a damaged liver you do not want to miss. Your liver is a huge organ. It's the second largest organ in the body, and it has so many jobs. It produces bile, it filters your blood, it's responsible for metabolism of proteins, carbohydrates, lipids, and it detoxifies the body. But it can be seriously damaged by, well, consumption of too much alcohol, a liver toxin. It also can be damaged secondary to underlying genetic or medical conditions such as certain autoimmune diseases. And it can be damaged as an adverse side effect to certain medications, or certain dietary herbal supplements can damage your liver. And many people have what's called fatty liver disease, which ultimately can lead to scarring down, damage of the liver, otherwise known as cirrhosis. Your skin is a window to what is going on internally, and there are some fascinating warning signs of damaged liver that appear on your skin, as well as your nails and your hair. When your liver becomes damaged, things go awry in the realm of blood clotting, estrogen metabolism, and the blood vessels in your arms and legs, they dilate. You have kind of abnormal circulation all of a sudden through your arms, your legs, throughout your skin. And one of the ways in which a damaged liver is going to show up as a result of these changes is you're going to notice all of a sudden you have red palms. Palmar erythema is the proper terminology for this finding, especially red on what's called the thenar eminence and the finger pads. This redness will blanch, meaning when you touch it, you press down on it with your finger or a glass slide, the redness goes away, but as soon as you relieve that pressure, it comes right back. Palmar erythema in liver disease is thought to be the result of, again, the abnormal circulation going on, as well as increases in estrogen. Now, to be clear, palmar erythema is not specific for liver disease. Palmar erythema can also be seen in rheumatoid arthritis, hyperthyroidism, diabetes, and it is a very common finding in pregnancy. So if you are at home pregnant, you look down at your hands, they are red. Do not panic. That's actually very normal with pregnancy. As a side note, I actually have a video going into a deep dive on palmar erythema, all of the other potential underlying medical conditions, but it does often manifest in patients who have serious liver disease. Number 2 is something called spider angiomas. Again, this is related to a combination of perhaps the abnormal circulation as well as an increase in estrogens. Remember, your liver, it's responsible for hormone metabolism. When you have a damaged liver, estrogen becomes high and it can make all of a sudden these little abnormal blood vessels appear on the skin, a very large vessel, and then you have all these tiny little blood vessels radiating out from it. You see that on the skin. It looks like a little spider web. It's red. Like palmar erythema, these are not specific to liver damage. So if you have a couple of these, don't freak out. We can also see prominent telangiectasias in the skin condition rosacea. In contrast to rosacea, telangiectasias from a damaged liver are not going to be associated with the other signs and symptoms of rosacea, such as flushing, blushing, burning, sensitivity, those little bumps that can be filled with pus. You're not going to see that with the dilated blood vessels from a spider angioma related to a damaged liver. Spider angiomas can be seen in 10 to 15% of otherwise healthy people. For example, they might pop up in teenagers here and there, not an uncommon finding, but also they can be seen in pregnant women or in women who are taking hormonal contraceptives, birth control pills that have an estrogen component sometimes might develop these. However, when they become concerning and a warning sign of potential liver damage is when they kind of appear all of a sudden and you have multiple, and there's no history of being pregnant or taking birth control pills. 33% of patients with cirrhosis of the liver will have spider angiomas. It's prominent dilated blood vessels. Telangiectasias look like a spider web. Spider angiomas range anywhere from a few millimeters to a centimeter in diameter. Another contributing factor in the formation of these, as it relates to people who consume excessive amounts of alcohol to the point that it has damaged their liver, in addition to the problems with estrogen and circulation throughout the body. There's also the fact that alcohol leads to an increase in something called vascular endothelial growth factor. So that stimulates these blood vessels to kind of pop up abnormally because the levels of the growth factor are like up there as a result of all the alcohol consumption. Number 3 is an arteriovenous hemangioma. These pop up usually on the head and neck, often on the lips. I've seen a lot of them on the lips. Red, blue, soft, almost like a nodule. This is basically a tumor of blood vessels. And it, again, related to the increase in vascular endothelial growth factor, abnormal circulating estrogen levels, and problems with just overall circulation in the periphery being somewhat off, gives rise to these growths, basically. They're a lot more prevalent in middle-aged men, but anybody with a damaged liver can have these. If the liver disease is treated, alleviated, improved upon, well, these will regress. Number 4 is the paper money sign. So patients with a damaged liver, or cirrhosis of the liver, can get so many of those little spider angiomas, but sometimes in an eruption, sort of in a more widespread fashion, to the point where if you take a step back and you look at their skin, it looks like that little thread that goes through, well, paper money, like bills, that security thread. These commonly will show up in crops on the neck, the chest. Number 5 is a Caput Medusa. Wow, Medusa, Greek mythology, you know, she had the head of all those snakes. Because the liver is such a huge organ and all this blood is circulating through it, when it gets scarred down, well, you get a backup in flow and you get a lot of increase in pressure in your abdomen, and that slows down and backs up the flow of blood around. You can get very prominent varicose veins on your abdomen, on your stomach, upper chest area. You know, we've seen prominent varicose veins in people who have who are on their feet all day. You see those on your legs, right? But when they pop up on the stomach, that is a warning sign of a damaged liver. And the name Caput Medusa refers to the fact that there will be these large varicose veins with kind of radiating projections, looks like, well, Medusa's head, kind of coming out around the umbilicus, the belly button. Number 6 is jaundice, this yellowish discoloration of the skin, the whites of the eyes, and the mucous membranes. This yellowish discoloration is basically accumulation of bilirubin, and it is seen in patients whose liver has been damaged to the point where their bilirubin levels rise to above 2 milligrams per deciliter. You want to check the whites of the eyes and the mucous membranes because there are a lot of things that can make the skin yellowish. For example, if you eat a lot of carrots or pumpkin, you can develop what's called keratinoderma, that kind of yellowish color. But in contrast to jaundice, keratinoderma is not going to affect the whites of your eyes or the mucous membrane. So with jaundice, a real telltale sign is if you look under the tongue, you can see a yellowish discoloration. That's kind of one of the first areas where it pops up. Or the back of your throat, that little hangy ball thing called the uvula will also be yellow. The color of jaundice varies anywhere from sort of a lemon yellow to an apple green. Number 7 is not necessarily a skin finding immediately, but a skin feeling, and that is itch. Man, having a damaged liver will leave you very itchy, especially on your arms and legs, and the itch can be persistent or it can come and go. The itch of liver disease often leads to very itchy palms and soles of the feet. It's thought to be related to a variety of things: increases in your body's opioids, bile salts, as well as progesterone metabolites. Number 8 is pigmentation. It is not uncommon for patients with a damaged liver to present with this abnormal pigmentation on the face. Some people refer to this as hepatic face. It's this muddy gray complexion thought to be the result of disruption in hormone metabolism. Patients with a damaged liver also often have this black discoloration on their arms and legs. And last but not least is a nail finding. Not the only one, but one that is often seen in liver disease. It's called Terry's nails. What the heck are Terry's nails? Well, you have a prominent white nail bed, but if you look at the tip of the nails, you see this reddish brown brown transverse band about 1/2 to 2 millimeters in diameter. And with Terry's nails, you'll also notice that the lunula, the little half moons, are absent. Now, like with many of these other skin findings, Terry's nails can be seen in some other underlying medical conditions like congestive heart failure, for example, but they are something that is seen in liver damage, and it's thought to be, again, related to kind of this abnormality in blood vessel formation and a tendency towards making telangiectasias. Might underscore that red transverse band that you see at the tip along with the background white nail bed. All right, y'all, so that is a wrap up of 9 warning signs of a damaged liver not to miss. But let me tell you, we have barely scratched the surface. There are even more findings, more nail signs, more skin signs, more hair signs that I didn't even get into in today's video. So when you say, why is a dermatologist talking about warning signs of liver disease? Let me tell you, dermatologists are going to identify liver disease in a lot of cases because the skin provides the clue. All right, y'all, I hope this video was informative, educational, and that you enjoyed it. I have a whole playlist on my channel detailing many other skin findings associated with a whole host of different health problems, thyroid disease, B12 deficiency. If you enjoy these types of videos, check out that playlist. I'm going to put one of my most recent videos from the playlist on the end slate. So that slide that's going to come up next, once I disappear, it's going to have a thumbnail. If you tap on that thumbnail, it'll take you to that video. So you can watch that next if you so care to. But if you guys enjoyed this one, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.